Hi, Senator Parent.
Hi, how are you?
I'm good. How are you?
I'm great, thanks. Good morning.
Good morning. You work with Calvin and Hillary in our office, correct?
I do.
Awesome.
They're
Awesome.
awesome. And I know Callum just had a baby,
I
so
know. Yes.
so
How
excited for them.
exciting. Yes. How's everything going?
Great. It's hot. I'm like, whoa, here we go, summer, right?
Yeah.
Yeah, so my kids will finish school this week and looking forward to not having to get up quite as early and a fun summer.
Of course. Well, good, good, good. Hi, Representative Wilson.
Hello, hello.
How are you?
I'm great. How are y'all doing?
Good. Okay, so it
Great.
looks like we're all live.
Yeah.
I'm not sure if we're ready to start. All right, so we are ready to get started. So thank you, Senator Parent and Representative Wilson, for being with us today. I'm Kendra Price. I am the Government Affairs Manager at Emory University, and welcome to our audience. So today, I want to welcome you all to today's discussion concerning health and wellness. The pandemic continues making health and wellness a hot topic, not only at the dinner table, but for government as well. So as we go through this conversation with Senator Parent and Representative Wilson, I want to ask that everyone, if you have any questions, please use the chat feature to the right-hand side of the screen, and we will address your questions as they do come up. So I do have questions for our panel today, and feel free to jump right in and answer Senator Parent or Representative Wilson as you see fit. As we saw COVID-19 impact businesses, residents, and cities, how did the state legislature address the ongoing virus and its impact?
Well, two things we did right off the bat were one was, quite unfortunate. We slashed a lot of our budget. We took a break right after crossover day in 2020, which I think was either probably day 28 or 29. And, things had been sort of accelerating that week as it related to news about the pandemic, both worldwide in the States and in Georgia. And then as the day went on, it was okay, schools are closed, the governor's closing down schools. We're not coming back. We had to go back. Because the governor declared a public health state of emergency, we did have to go back that next Monday and ratify the state of emergency. That was actually somewhat disastrous because what I thought would be a 1 hour meeting of the General Assembly turned into an 8 hour affair where no one had masks, everyone was still congregating, and we had a lot of people who were positive. And so it probably ended up being somewhat of a spreader event, although we, of course, had all been together earlier that last week. But after that, we didn't resume the session until the end of June. And some of you may know that the fiscal year in Georgia starts July 1st. So we had to pass our budget for the next fiscal year before July 1st. So when we came back, we cut spending quite a bit. And that's in some key areas that impact society and impact business, big cuts for education, mental health, and really it was almost every single budget. The numbers kept changing. In the end, actually, our revenues have held up quite well, which is good, I think, for business as well as for Georgians. Another thing, and actually, I should really quickly say we do still have cuts in place, some of which I don't agree with. We do, however, have the federal relief funds coming into the state. So that's sort of a side conversation. But another thing that we did that actually Representative Wilson should weigh in on as well, because he was instrumental in negotiating, was we changed the liability standard for businesses and for hospitals and healthcare as it related to potential lawsuits about transmission of COVID. Everyone was freaking out, as we can all imagine, because it was such a novel and scary thing at that time. And as I already said, masks were just sort of slowly rolling out. Representative Wilson, you probably want to discuss some of maybe the negotiations about that. That is legislation that both of us voted for a year ago. It has been renewed for a year. We both voted against it on the renewal, though. And I'll just briefly say before turning it over to Representative Wilson that I felt like there are some sort of technical legal reasons that I felt that it wasn't necessary anymore. But a bigger reason is that, we had reached the point where we all sort of understood how to live more with this virus and be safe with it in a way that I think no one really could fully understand by last April, May, June. And it didn't seem justifiable to me anymore but I know we want to hear from Representative Wilson.
Yeah, so I think that other than and that was a great explanation of sort of the budget that we walked through. We've had 2 sessions now during COVID, 2020, the end of the 2020 session, and then the entire 2021 session was all during the pandemic. And other than the budget, I think that this liability legislation that Senator Parent mentioned is probably the most visible piece of legislation, or the most visible way that COVID has affected legislation directly here in Georgia. And so all of you have seen the impact of this legislation. If you've gone to a store, a school, a church, your office buildings, wherever, you see those signs posted on the front door that say, if you walk in here, you may get COVID and it's not our fault. That is from this bill. So this was a bill that was passed last year in 2020. And as Senator Parent mentioned, we both supported it then because at the time there was a lot of uncertainty about how we were going to continue to navigate our daily lives and go to work and all these other things, go to the grocery store during the pandemic, while we still don't quite know what we're dealing with, and how long it might last, how to protect ourselves, and the information was constantly evolving. And you remember that because we were all living through it together. So what we did last year in 2020 was pass a bill that said, okay, look, all business owners are going to be protected from liability as long as they follow the basic standards. And one way that they can demonstrate that is putting that sign on the front door. And another thing that did in 2020 was it was only good for 1 year. So there was what we call a sunset provision. After a year, the law went away. And we were all hoping that the pandemic would be gone after a year, after we passed that bill. One more thing I want to mention about that, part of the reason why we also supported that last year was because up until then, the governor's executive orders controlled what was happening because the legislature had not occupied that space yet. We had not passed a bill on that issue. And the governor's executive orders were very broad and very expansive. And so part of the reason why a lot of different groups came together on that bill in 2020 was because the governor's executive orders were considered way worse, for the trial lawyer community, for example, because if you look at healthcare or health providers, hospitals, doctors' offices, things like that, they were able not only to be immune from liability of COVID, infections, but also anything else that happened on their premises during the pandemic. So just routine negligence events like slip and falls, accidents, or personal injury type accidents would be swept into this bill as well. And that just was not. That's not how we encourage good behavior on the part of property owners, and so a lot of us were trying to get past that. Fast forward to this year, a lot of us did not support the extension of that bill this year because what has changed in a year? Well, a lot has changed in a year. We now know what we're dealing with. We know now specific things that business owners and property owners can do to protect individuals coming onto their property. And we also know that frontline workers are some of the most affected by this issue. And so we really wanted to put in more protections for employees and workers. And that was just a non-negotiable for the other side. And so a lot of us walked away from the table on that issue. They still had enough votes to pass that bill, so it did go back into effect for another year, and as we continue to navigate the pandemic.
Well, that is good information to know. Some of this I do follow, but some of it I just didn't know. But thanks for that explanation. So I just wanted to mention that it is nice to have that sunset clause in order to be able to be agile and able to adjust to support to the community at large. So thank you for supporting that. So next question is, what can businesses expect from the state next year in regards to receiving the support they need to get back up and running?
Can go ahead first this time?
Sure. Lots of federal money, to put it succinctly.
Okay.
I think, a lot of us, I'm sure, are following what the federal government is doing as from a statewide perspective. And if you read the AJC this morning, there's a great article about the cities and DeKalb County receiving stimulus money and sort of how it's going to be divvied up among the cities. I know Brookhaven is getting a big chunk of that money, but all the cities in DeKalb County and the county itself is receiving a lot of stimulus money, and details about how that's going to be spent are kind of rolling out. That money must be spent on, basically, it must be pushed out the door. So it's got to be spent on infrastructure. It's got to be spent on helping small businesses. It's got to be spent on projects. It can't be used to pay off debt. It can't be used for tax offsets, things like that. On the state level, we're expected to receive just shy of $5 billion from the federal government. That, just to put it in context for you, that's about 17% of our state budget that we're going to get in one fell swoop. Senator Parent was mentioning earlier, part of the argument that we heard the last 2 years for our state budget being pared down and cuts being made, even though we saw tax revenue coming in during the pandemic, so we knew we were going to be in sound financial shape. Part of the argument that the budget drafters gave was, well, we know we're going to be getting a lot of federal money. And, as a Democrat, I found that very offensive, because at the same time that the Republican budget writers were saying, we're going to cut the state budget and state programs because we'll just offset it with the federal money that comes in later. At the same time that was happening, we had Republican leaders, the governor in particular, on Fox News beating our Democratic U.S. senators and Democratic president over the head, saying they're spending too much money for stimulus relief. And I'm like, okay, so you're passing a budget that depends on them spending money while you go on TV and yell that they're spending money, and you don't want them spending money. Can't have it both ways. But we are getting $5 billion because right now the most important thing, and of course everyone here knows, the most important thing is continuing our economy running and continuing to employ people, and so that we can get back to normal. One key thing to keep in mind, and I'm going to say this and I'm going to shut up so Senator Parent can talk. One key thing to keep in mind is this money does not go through the normal budget process. So the legislature will not get a direct say on how that money gets spent. It goes to the governor, and the governor will decide how it is spent and how, more importantly, how it is reported. And so the first federal stimulus that we got through the CARES Act money that came to the state, we're still trying to learn how every dollar of that allocation was spent. So that's one thing that I'm concerned about, but we're all going to be looking to the governor's office to see where that money is going to go.
Right, absolutely. So I just want to mention a couple really big key areas in the state budget that there's been ostensible bipartisan agreement that more spending is needed. And one of the things that it's important to remember is that this money is, of course, a one-time infusion, and so therefore utilizing it to cut budgets is risky for that reason alone. Because I just want to point out that, as sort of part of this discussion, that we have a formula called the Quality Basic Education Funding Formula that we utilize in Georgia to decide how much state money will go for every student across the state. And that formula in and of itself, it dates to the 80s. There have been successive efforts to reform it, update it. They've always faltered. So it's outdated to begin with. And the key point I want to make quickly is that even in its outdated form, it has only been fully funded twice in the last 20 years. Twice. And so the fact that that 400 to 500 million in cuts remain in this year's budget that we're about to start this upcoming fiscal year's budget is concerning to me, because I don't see a lot of evidence that we do intend to fund education properly, despite rhetoric to the contrary. But that being said, there are some really key areas that Democrats have certainly pushed for more appropriate spending on, and that by the way, betters business, but also betters Georgia citizens, but also sets the stage for business to succeed, because you'll have the infrastructure needed, the workforce needed, et cetera. There's sort of, as I said, ostensible agreement out of the Republicans that these sort of investments are made, but it sort of remains to be seen whether or not that's talk, and when this money comes in, whether we'll see some more action. I don't think that we were anywhere near appropriately funding things like education, healthcare, or broadband infrastructure prior to the infusion of federal money. It remains to be seen whether we would appropriately fund them with this money and subsequent to the money being available to us as well. But those are areas where, as Representative Wilson stated, the governor is in control of this money, but there were like references to these are buckets that it would be appropriate to spend this federal money on within the budget that we passed.
Okay.
So we're trying to, carefully watch how the money is spent, but these are all extremely key areas. I already mentioned K through 12. What I was talking about with QBE, that's K through 12.
Okay.
We passed a bill several years ago that set up a framework for needs-based scholarships for post-secondary education. There's been somewhat bipartisan acknowledgement that we need a lot more Georgians to receive some post-secondary education in order to meet our workforce needs. How to accomplish that has been more open to dispute, but we did at least pass a framework to do some needs-based scholarships. That's one area, that this money could be well utilized for. Again, broadband, we had spent some money studying it and mapping all of the areas of the state that simply don't have internet access, which in, modern society is a real problem for economic development. And that was, and even for daily living, right? It was driven home when the schools had to shut down, how indispensable it really is to be able to have internet access today. And it's certainly, and there was already acknowledgement that was a economic development problem for businesses in that area. So that's another area where we had sort of talked about it for years, but really it needed investment. It wasn't profitable, despite all the wishes and chatter, out of some of our Republican colleagues. It's simply not profitable for private business to put in the huge investment in laying down lines when they only get a few customers. It always was going to take, kind of like roads and bridges and other things. I know there's beef or disagreement about what is in President Biden's proposal. Broadband is one of those things that's in there and that I firmly believe absolutely counts as infrastructure in today's modern era. Healthcare is another big issue, especially in our rural areas where we've had failing hospitals. That is a problem from a health and wellness perspective. We're talking about also failing from causing hurdles for economic development as well, frankly. Medicaid expansion is part of that. I believe that Georgia will eventually expand Medicaid. Right now, we're waiting on the Biden administration to tell us whether we can move forward with this very silly proposal cooked up by Governor Kemp. The reason I say it's silly is because it is a sort of kind of partial Medicaid expansion, but falls so far short of what's available to us through the Affordable Care Act that it would basically cover 50,000 people out of 500,000 uninsured and in the gap that we currently have for about the same amount of money that covering all 500,000 would cost. So it would be a lot to get into all the nuances of that proposal, why it's like that. But suffice it to say that essentially the Biden administration put a hold on it.
Okay.
So if they reject it, then it will be pretty clear that the only path that makes sense for Georgia will be full Medicaid expansion. Of course, we're talking, 10 years after, frankly, we should have done it, because all of the money that we've put in as taxpayers has gone to support the program in other states. We've had 500,000 Georgians unable to access it, mostly for ideological reasons. In Georgia, we started out where the governor had the power to expand Medicaid. Early on in debates about the Affordable Care Act, legislation was passed and signed by Governor Deal that said that the legislature also had to sign off on it. So that's a hurdle because it means 237 people weighing in on it as opposed to just one. But it will happen. It's just a question of when. Looking forward over the near term, it would actually be a great move for Governor Kemp to lead a push to expand Medicaid for his reelection chances, frankly. However, there is still a lot of opposition to the notion within the diehard Republican primary electorate. And he's busy trying to shore himself up with that very electorate after coming under so much criticism from President Trump as it relates to sort of not interfering and illegally trying to stop the certification of Georgia's presidential election. So as always, there's the policy that one has to think through. The politics are a totally different animal and beast. But as it relates to health and wellness in Georgia, doing that would be the single biggest thing that is really easy to do, that's within our power to improve where we stand for Georgians.
Well, these are really good insights and great information that you're sharing with us today. I want to just remind our audience, if you have questions for Senator Parent or Representative Wilson, to please drop them in the chat, and we will continue with our conversation until about 10:50. So the next question that I have is, will we see any state resources from a budget perspective given to mental health and overall wellness for businesses and municipalities that are implementing stronger wellness plans?
I think that sort of thing is very forward thinking. I think it's totally appropriate. I'm glad to see businesses start to go in that direction over the last, 5 to 10 years. From a state investment perspective, that I'm not as optimistic that we would see a lot of that quickly. Health and wellness tend to be sort of more like afterthoughts or areas of the state budget where people are quick to go to for for cuts. I don't see a lot of fervor for these sorts of things as far as state resources go. I think it's really an area where we've seen so many times over the last decade where what businesses do is critical, and the leadership that can be provided by businesses is critical, because businesses engage with society at large. They have employees from all sectors of society, of all political beliefs. They want customers from all segments of society and political beliefs. And therefore, in some ways, they are more nimble than politicians currently are, given our polarized society, to reflect the middle of the electorate. So that's an area where I really applaud and encourage business to continue to lead with these sort of incentive programs. I've seen a lot of them in my own life with private insurance, and I think it's a great thing. And I'm less convinced, frankly, that our governor or state Republican leadership would be as innovative or as nimble as a business could be in that regard.
Yeah, I think that if we are going to see any of that investment from the state, it's going to be from this federal stimulus money, not from the normal budget process. When you look at the normal budget, we just have made critical cuts for so many years now to just basic programming, that something that's more innovative like this, it's too easy to label it as extra. And so I don't see it coming from the normal budget process, but I do think that there's a chance that something like that could come out of the stimulus funds that Georgia is receiving. I think that Governor Kemp has, it's not hard to see how much he values the business community in Georgia, and how much he listens to them, and how much he speaks their name, invokes their name all the time. And that's not necessarily a bad thing. But I would just urge him to think about the people that make up those businesses a lot more than just the business itself. But I say that because I think that Governor Kemp is going to be looking for innovative ways to spend that stimulus money. And again, it's solely up to him and his team how that money gets spent. So I think that if there's an innovative idea, like supporting wellness programs throughout the state, that potentially there's room there to get an appropriation. But again, to the point that Senator Parent made before, this is a one-time allocation, and so this is one moment in time. It will not, it's very unlikely that this will happen again anytime soon, given how large the stimulus package is, and how difficult it's been to get it through Congress. So we would like to see state support and investment in the normal budget process, because that sort of communicates our more long-term priorities. Some of the ways that we addressed healthcare this past session through the budget, again, the actual funding of programs was cut back, very counterintuitively, because we saw money coming in the door, and we know these programs are at a demand level unprecedented, just given the pandemic and everything else, the ripple effects of the pandemic. All of our state programs are under incredible stress right now, and they were already under stress and unfunded, and so they're kind of in dire shape right now, to be quite frank. But I very quickly to highlight two things that we did this past session in the budget process, to show you how sort of the approach right now is much more indirect impact. two bills, one from the Senate, one from the House. Senate Bill 80 from Senator Kay Kirkpatrick dealt with ensuring transparency and prior authorizations, and sort of making that process much more transparent to the patient, and sort of standardize it across all insurers and make it easier for patients to sort of navigate. So you know ahead of time if your treatment is going to be considered in plan, and if not, why. And then, so again, more on the transaction side of that equation. And then also, similarly, House Bill 163 that was sponsored by Representative Sharon Cooper. This bill sort of required Georgia's Medicaid program to adopt what we call express lane eligibility for children's Medicaid. So basically, we have children in state programs that we know a lot of information about, and we basically just on the information we have, without that child's family submitting an application for Medicaid, we know whether that child is eligible for Medicaid or not. And so basically what this requires the state to do is to use the data it already has to determine if the child is eligible for Medicaid, and if so, to go ahead and automatically enroll that child in Medicaid. That's something that costs basically nothing. It can be absorbed by current programs that are already in place and current staff that is already in place, but is getting at sort of the healthcare needs that our state has. That is not nearly enough. And if you ask Senator Barrett and I, we could tell you about 50 other things that the state should be doing, very, very big things that the state should be doing in healthcare. But those are the types of bills that are the only ones that are really moving through the legislature right now, given the polarization and given the strategy, if you want to call it that, of significantly underfunding our state budget.
Right. And I just want to mention, one of the areas that really became a cause for concern over the past year was that we've had substantial disinvestment over the decades in Georgia's public health network and infrastructure. Some of the research I did showed that Fulton County, for example, at one point had 300 nurses on staff and was down to 30 before we got into COVID. And guess what it showed? It showed in how localities were able to respond when the crisis first erupted. It showed in the ability to deploy vaccines. So you can't really starve these agencies and then think they'll be able to be appropriately able to tackle a pandemic when the need arises. I guess maybe some of our colleagues might say, well, a pandemic is going to only come around every so often. Maybe the state could have responded better. We were at like the bottom of numerous lists, but like maybe they don't really care and they think it's worth it to not have that capability. I don't know. That's an ideological policy discussion that we should have.
Right. We've had a lot of challenges. I do have a question from the audience. So it says, given the impact of COVID isolation, there seems to be a rising need. Can you speak about what might be helpful for the public and to businesses in order to advocate and get more support and bring this to the forefront?
So I want to make sure that with Ms. Reed's question, I understand what this and rising need refer to specifically, because she wrote it a few minutes ago. And so I'm not, and then I do have some comments on, the mental health support. Okay.
Sorry about that.
Ms. Reed. And and I do have some comments on her other question about childcare. It really is a rising need. There is just, let's see. I'm like spinning my wheels on effective advocacy. There are certainly advocacy groups and people that do good work at the state capitol advocating around mental health in a variety of ways. I would say a little less so. I haven't seen as much strict advocacy around wellness more broadly, or at least not in sort of like a cogent fashion. You know, I mean, like one of the groups that advocates, you know, people advocate for suicide prevention and do some good work. But, you know, for example, on that segment of mental health and that issue, guns is kind of this like elephant in the room on the conversation when, you know, the stats are quite clear that when you're having a moment of crisis, if there's a gun nearby or in the home, that's significantly more dangerous and far more people die of suicide by firearm than by any other means. But we're not doing anything on that, right? I mean, so that, and I know that's only like one little part. Well, it's a big part. It's a big part, but around the mental health discussion, as far as access to mental health services, that is really not something I have discussed at all out of the Republicans on. I mean, I applaud what private insurance has done around that. We have significant challenges with lack of affordable mental health programs for children and teens. Like that's a huge area that really needs some attention and investment. There are not nearly enough professionals in that space to begin with. And most of them, you know, are going to be private pay, the ones that are going to accept Medicaid or Peach Care are too few and far between. That's an area that I think needs a lot of work. I have not seen any interest in that. I can't think of any Republican that's really led an effort on mental health. Can you, Matthew?
Oh.
No, and I can tell you, you know, I think. Well, let me talk about that, and then I'll go back to what I was going to say. Actually, I co-sponsored a bill with Representative Shelley Hutchinson from Gwinnett County this year, and it's been introduced before in various forms, but it's titled the Mental Health Parity Act, and that is, I think, one way that we can get some mental health, you know, additional treatment and support for treatment and coverage here in Georgia. Given the climate that we're in, again, knowing that the Georgia legislature for the time being is not going to invest any money in significant mental health treatment programs. But this would require insurers to, you know, treat claims that concern mental and substance abuse disorders on par with other health insurance claims, which would increase coverage, basically. So we're requiring something of private insurers. We're not necessarily costing the state additional money. And to Senator Parent's point, we just were not able to get bipartisan support for that this year. The legislative session is a 2-year session, so we picked up in January right where we left off this year. So we're hoping that we can make additional movement on that particular bill, because I think that is an easy win. To Senator Parent's point, it's an easy win for Republican leaders to expand coverage without necessarily costing the state anything. And you know, I think that we have great opportunity right now, because there's you know, huge mental health needs among Georgians. We've got this infusion of federal stimulus money, and let's be frank, remembering that everything should be looked at through the policy and the politics lens, right? Next year is a really big election year for the state of Georgia. Every legislator is up for re-election. Every statewide constitutional officer is on the ballot. And so, if you ask me what is the best way to get more programming and coverage and funds for mental health, ask every candidate you can. What are they going to do to increase mental health coverage in Georgia? And I think if we can get the gubernatorial candidates, obviously Governor Kemp is running again. If we can get him on par, I know Governor Abrams is going to expand mental health access in Georgia. We know that. But also the legislative, the state house and the state senate candidates, making sure that you get them on record. What are they going to do for mental health? What are you going to support for mental health? And don't just say, well, we can't get it done. Okay, well, what are you going to do? What bill are you going to file? Who are you going to talk to? How can we get this done? Because Georgia has a horrific history on mental health care and has been sued before multiple times in the past, and the federal government has had to say, Georgia, you are not taking care of your own people, and you need to do better. And if we don't seize this opportunity that we have right now, we very well might be in a similar position, not too far from now.
No, that's a great point. We have not seen much support in that area, as everyone can see, with so many people being arrested for their mental health crisis and problems, the homelessness. So I agree. So we have 5 minutes left. I just wanted to get your final closing thoughts on what there is that we need to do as a business community, as citizens of DeKalb County. So please feel free to speak on that. We have about 5 more minutes. Senator Parent, do you want to go
Sure.
first?
Matthew made a great point that Governor Kemp, as well as Governor Deal before him, really values the business community. And I already mentioned how I think that in many ways the business community is, in today's polarized society, somewhat uniquely situated to try to navigate and better and reflect better than the political system does, the true sort of like middle 50% of the electorate, which is really what our system is supposed to do, our democratic system. But due to a variety of factors, it's faltering in that, in the current environment. I have some things that I'd like to fix to help that along, but failing that, I do think the business community not only has a important voice, but some responsibility. So I think that understanding that there is some power there and forming coalitions. I mean, obviously the chambers of commerce that, we're speaking with this morning have formed coalitions.
Correct.
But what direct advocacy have you done? Is it just part of what like the Metro Atlanta Chamber or the Georgia Chamber do? And sometimes they do really good things. There's always an ability to assess the landscape before January, and maybe together or with a few other local chambers, as opposed to only working through maybe Georgia Chamber or what have you, pick an issue and dip your toes a little bit more in more individual direct advocacy out of the groups represented here today, and start, fairly small. Obviously it's a big job. It's a lot of work. So start manageable and spend some time down at our state capitol and trying to have conversations with some of the leaders, not just within our delegation, but of important committees, and of each of the respective legislative chambers would be my recommendation.
Great point. So a lot of grassroots efforts building up and making our voices heard to the people who can hear us.
Yes, and as businesses, I mean, you also have ready, you have your own megaphones, as well as built-in constituencies that can be encouraged to also be advocates in customers and workers.
Great points. Great points. Thank you for that. Representative Wilson.
Yeah, and I would just say, two things. My challenge to you would be twofold. You, the business community. One, make sure that you have systems in place where you are having an ongoing dialogue with your employees and your workers, and you know what is of critical importance to them. Because I think a lot of times, and as a policymaker, I know we're certainly guilty of this. A lot of times we say, well, our constituents stand for A, B, and C. Well, have you actually talked to them? Do you know that? And it changes, right? Because people, circumstances change.
Right.
And so my challenge first would be make sure that you have a system in place where your employees and workers and the people that make up your team are able to communicate freely on issues that we're all experiencing in life. Because one thing that we saw through the pandemic, but the pandemic really heightened this, was the incredible amount of pressure placed on businesses and corporations to take a stand on things that groups felt like they should be taking a stand on, and sort of how to navigate that. And so I think having that system in place for internal dialogue is crucially important for all businesses. And the second thing I would challenge you to do is to Elena's point, is err on the side of speaking out on legislation, on issues. I think historically, traditionally, businesses have there's been a wall between sort of policy and businesses and lawmakers, and the only interaction is really on direct things that directly affect the business interests, and that's fair. But again, what we're seeing is consumers, employees, and even policymakers are really dragging corporations and businesses over into the policymaking ring and saying, look, you have a big microphone that you use very selectively for understandable reasons, but we're asking you to use it more. And so I would just say, err on the side of speaking out more.
All right, so I heard from that. Great. Listening and then making your voices heard. So yes, with that, I just want to thank you both for being with us today. Thank you for your insight and your engagement. Thank you for being with us and all that you do for us. So we appreciate you. If you ever need us, please reach out. To our audience members, I want to ask that you will leave this session and go over to the back to the stage for closing remarks. Again, Senator Parent and Representative Wilson, thank you so much for being with us today. We appreciate you.
Thank you for
you all.
having us.
Take care.
Bye.
You too.
Bye.